Hello, everyone, and welcome to another Zoom episode of Two Peas in a Podcast. We love to meet in person, but with the restrictions as they are and the extension of the restrictions, we're so grateful for Zoom. Yeah, Carl's making a
Shout
sound.
out to Zoom.
Shout out to Zoom. Thank you for letting us do our podcast. So I am joined by the lovely Carls today.
Hi.
Hi. So today we're going to be talking about adult ADHD. So I think Carl's brought this up, and I think it's so valuable to talk about because, as we mentioned in our other podcast about OCD, sometimes people don't know what it is, and they kind of use the term a little bit loosely, like with OCD. I'm so OCD, and we're just talking about appropriateness of when kind of to use this language. ADHD is the same. I've heard a lot of people say like, oh, I'm so ADHD today, or like, I can't focus, I must have ADHD, or they go to their doctor and they get a diagnosis very easily. So I think it's important to understand kind of the signs of ADHD and what it looks like and just appropriateness of when to kind of to use this language.
For sure. And I think the hard thing, like the reason why I wanted to cover adult ADHD is typically when we think of ADD or ADHD, we think of, I say tunas, we think of kids, we think of young children primarily. And I've had a lot of people come to me recently for some reason. I'm not sure like what stars are aligning or what's going on. But they think that they have adult ADHD. So I thought, why not cover this topic? Maybe it'll shed some light on some things for some folks. So ADHD stands for Attention Deficit Hyperactivity Disorder. I know it's kind of a mouthful. So basically it's a mental disorder that includes kind of a combination of persistent problems. So difficulty paying attention is like the key one, hyperactivity and impulsive behavior as well. Especially adult ADHD can lead to, like unstable relationships, poor work, poor academic performance, which is why a lot of people have noticed that are our age. They're transitioning, whether they're in university, whether they're in some sort of program, and they're noticing that it's having an effect on their academia. It can also lead to low self-esteem, and then there's like a whole gambit of other kind of related problems that you can kind of see down the road. So it's something that we should be talking about, especially in adults. Some people just go undiagnosed throughout their childhood, and then it pops up and they're like, what the heck is this? Why is this happening? Like, I've always had problems focusing, but yeah, so we just thought it would be important to kind of shed light on this topic.
Absolutely. I think it's important. And a lot of people do think that they have it. It's true. I thought I've had it like a couple times. I am trying to study and I can't focus and my mind is going to different places, or there's times where I'm so hyper focused on something and I can't break out of that. So there's definitely been times where I've thought about that too. So I think it's important to actually like understand what all of the symptoms are so that we don't jump to a conclusion, or we panic, or we try to self-diagnose ourselves or go to our doctor and say like, I'm experiencing all these things, because as kind of we were chatting, it's not that hard to get a diagnosis these days, which is unfortunate depending on who you go see. So it's valuable to understand your own self and your own behaviors, because there might be other people that may label you or tell you that you are struggling with something, and then in reality you're not. You struggle, but it might not be a full blown diagnoses. So yeah, we wanted to kind of give a breakdown of
And many adults with ADHD, they aren't actually aware that they have it. They just know that these everyday tasks are really, really challenging, and they're wondering like why that might be, like what is like wrong with me in a sense. So I think an important thing to mention too is that almost everybody has symptoms that are similar to ADHD. Like Amelia mentioned, she was like, do I have ADHD? I have too felt the same way, where it's really, really hard to focus. So that will pop up probably at some point in our lives. And if your difficulties are like relatively recent, or they occurred maybe only occasionally in the past, I'm gonna say it's likely that you don't have ADHD. Like I'm just gonna like throw that out there. I think it's a term that's really tossed around quite a lot. So I think it's important to recognize um, some signs and symptoms. And I know Amelia is gonna kind of go into that a little bit later on as to do I really have this, or is this kind of just like a normal human thing that's going on in my brain?
Right. Very valuable. I also like that you brought up the fact that there are, on the other side of things, there are people who don't know they have it. They just know that daily tasks are really impossible, or they feel like they're impossible and they're not sure what is going on. So I think there's two sides to it. And it's so valuable to bring light and talk about both sides of things, because maybe you're someone who doesn't think about diagnoses very often. Maybe you're not in the field of mental health, or you don't talk about it very often, or just never something you talked about in your family or your friend group or whatever circles you're traveling in. And if you're truly struggling, it's important to give voice to those. So both sides of the spectrum are really important.
Mm-hmm, for sure. And I think that well, from what I've like heard and from what I've seen, the diagnoses of adult ADHD can be really difficult because ADHD symptoms are really similar to those caused by like other conditions, so anxiety or mood disorders, for example. And many adults with ADHD also have, I read this somewhere, but they have at least one other mental condition, such as depression or anxiety.
Mm.
So those can kind of like coincide too.
Interesting, the comorbidity between them. It makes sense though, because if
Yeah.
you're struggling through focusing and you can't, and you're not doing well in school, or you're struggling with your social life or whatever it is, of course it makes sense that you would also be confounded with depression or anxiety or something else. It makes sense because it's such an impact on your daily life.
For sure. Another hard thing that I kind of wanted to shed some light on is like the diagnostic criteria itself for ADHD. It's not always, as we covered before, it's not always diagnosed in childhood, but symptoms must have been evident. I think it's before the age of like 12 for adult ADHD to actually be diagnosed. So that puts a lot of pressure on our ability to remember what our childhood was like. So often when you are getting diagnosed for adult ADHD, you'll meet with like a psychiatrist or a doctor, like a physician of some kind, and they will ask you what your childhood was like in order to like retrace if there were any signs or symptoms of ADHD, which I think is just, I don't know, to me, I guess it doesn't make a whole lot of sense, but I mean, I don't know. Do you have any thoughts on that, Amelia?
Yeah, I feel like it's really challenging because like I don't remember a lot of my childhood. Like there's some people who have like a really really good memory. My sister Sarah, for example, she has a crazy memory. She can remember everything, these little mundane details that my mom will say, "Yeah, that actually did happen and you were like 3 years old. How do you remember?" But for me, for example, I remember the snippets of my childhood, and I remember the hard times and the good times. But overall, as for my state of being as a kid, I don't really recall exactly how I was feeling for the majority of the time. I just remember like moments in my life. So I think if you're like me and your memory of your childhood isn't super super great, um,
Mm-hmm.
I think it's really challenging. If a doctor asked me about my history, I feel like I'd be able to answer it. But if it was for impulsive behavior, like how do you remember that if you were under the age of 12, or ADHD
Right.
symptoms, should I say? How do you remember
Right.
like, what you acted like when you were under the age of 12?
Right. And then perhaps that leads to relying on your parents or those people that were around you. But who knows if there's like a certain agenda or a bias also in their perspective. Like,
Yeah, that's
yeah.
really, really tricky. And I know that pattern behavior is the strongest indicator of future behavior. So they have to go into your childhood and they'll ask questions. And I think there's so much value in that. I really do. But relying on your own accountability of your childhood would be really difficult, because how do you remember exactly how you were?
Right. Exactly. Yeah.
That's tough. Well, I can go into some of the signs of adult ADHD if that's cool.
Yeah. Sounds cool.
Okay, sounds good. So I found 14. So
Oh,
Bear with me. So it's from a website called healthline.com. They have a lot of really good information there. So if anybody's interested in learning, healthline.com is really good. So they highlighted 14 signs of adult ADHD. So the first being a lack of focus, which extends to not being able to focus on conversations, not completing tasks, maybe academically or even just projects, etc. The second being hyperfocus. So it's kind of on the other side of the pendulum. I know it sounds contradictory, but an adult with ADHD may be so engrossed in something that they're doing, like so focused, that they lose sight of everyone else around them. The third was disorganization. The fourth being time management problems. The fifth being forgetfulness. The sixth being impulsivity. Example, interrupting others during conversations, being socially inappropriate, kind of not being able to read those social cues, um, rushing through tasks, and acting without much consideration for the consequences. The seventh is emotional problems, such as severe mood swings caused by very minor frustrations, just kind of inappropriate responses to a small situation. The eighth is poor self-image. Adults with ADHD are often hypercritical of themselves, which can lead to poor self-image. This is in part due to their inability to concentrate, as well as symptoms that may cause problems in school, work, or relationship. That was something that I didn't understand, the poor self-image part, but it does make sense because they're so focused on themselves, or they're struggling with social relationships, so they experience rejection, so it kind of feels like a reflection of them. So that was an interesting one that I didn't really know, so I thought that was important to talk about. Let's see where we're at now. The ninth is a lack of motivation. The 10th is restlessness and anxiety. The 11th is fatigue, which may be caused by the hyperactivity that encompasses an individual with ADHD, always on the go, always. It's hard to sleep sometimes when your mind is acting that quickly. The 12th is health problems, impulsivity, lack of motivation, emotional problems, and disorganization can lead a person with ADHD to neglect their health. This can be seen through compulsive poor eating, neglecting exercise, or foregoing important medication. Anxiety and stress also have negative impacts on health. The 13th is relationship issues. An adult with ADHD often has trouble with relationships, whether they are professional, romantic, or platonic friendship relationships. The traits of talking over people in conversations, inattentiveness, and being easily bored can be draining on relationships, as a person can come across as perhaps insensitive, irresponsible, or even uncaring. The 14th and final one is substance misuse. So they may misuse these substances in hopes of improving focuses on sleep or to relieve their anxiety. And as I said before too in our OCD episode, I don't want to focus too much on treatment because I don't know a lot about it, but CBT that aims to restructure your thoughts was also seen as a valuable way to work with ADHD. And then I also know medication too is something that is encouraged with ADHD, whether it's in childhood or adulthood. So that's my extensive list of kind of signs and symptoms to look for, and a little bit of treatment as well.
Awesome. Thanks for covering that. As you mentioned, medication is like very much pushed for ADHD stimulants like Adderall. Are used specifically, certain antidepressants as well. CBT is great for ADHD. And then also I thought that it was important to mention, because you covered, the lack of motivation in regards to exercise, because fixating on maybe like other things. So regular exercise, super important, as well as like a good sleep regime, like good sleep hygiene practices are really important for people with ADHD, and then also good eating habits as well.
Mm-hmm. Yeah, very valuable. I think it's just your mind is so busy and it's really hard to focus on things. So it's easy to let your health go or let your mental health go because you're not really focusing on things that are going to be valuable to your life because you're so busy thinking about how you can calm your thoughts, or just there's so many things going on. It's hard to focus on potentially, I hate to say like the right things, but it's hard to focus on things that are going to be serving to you.
For sure. Yeah, definitely.
Mm-hmm.
Awesome. Well, thanks for covering that, Amelia. We hope you all found value in today's episode on adult ADHD. Do you have anything else that you want to share?
No, I think that's good. I got all my points out.
Awesome. Super important. Well, thanks for listening and or watching, and we hope to see you back here for the next episode.
Mm-hmm. Thank you, everyone.
Bye.